Hi, everyone, and welcome back to our next discussion on patient engagement. Taking a completely different approach for this one, I'm going to have all new slate of guests, and we're happy to have them all here today to share their expertise. I'll get to introducing them in just a minute, but a few quick housekeeping reminders. Don't forget to join us for the 3 o'clock session for a huge announcement about about our digital virtual health series. And our last session, in which we're going to make that announcement, is social determinants of health focused. So we hope to see you there at 3 o'clock. Of course, I want to give a big shout out to Nutanix for supporting this session. We really enjoy working with the entire team at Nutanix, Cheryl and Susan and everyone else, in both our live events and our virtual events. So thank you for your continued support. And as a reminder, you can ask questions two ways during our session. You can use the raise hand function by clicking the button at the bottom of your screen, and I'll know that means you want to ask your question live. I can unmute you and you can ask your question live. So again, that's using the raise hand button. You can also drop your questions in the chat box. If you don't have the chat box open, make sure to click the chat icon at the very bottom of your screen right now. And the one thing you're going to want to do in that, as soon as you open that chat box, is where it says to all panelists. Change that to all panelists and attendees. That way, if you ask your question, all the panelists and the attendees can see it. And like happened in the last session, I'm sure there are attendees that might have some advice on your question as well. So again, change that to all panelists and attendees when you open that chat box. I'll also be dropping a link to the speaker bios in the chat box and asking a few fun questions along the way. So with that, I'm going to go ahead and get our esteemed speakers introduced. First up, we have Cheryl Rodenfels with Nutanix. She is the Chief Technology Officer for America's Healthcare. Welcome, Cheryl.
Hey, Stephen, glad to see you.
Glad to see you as well. And joining Cheryl, we have two special guests. We've got Kishore Ravilla, who's the Vice President and Chief Technology Officer at OhioHealth, and Jason Miller, who is the Senior Vice President and Chief Information Officer at Mednax. And of course, Rajiv Leventhal is back again to moderate this session. So I'll turn it over to you, Rajiv. I'm going to mute my microphone and my camera, and it's all yours. Take it away.
Great. Thanks, Stephen. Really happy to be here and excited to move forward with this great group and this great conversation that we're having today on patient engagement and organizations becoming more consumer focused. And this session is going to focus a lot on the technology aspects of that. We're going to talk about how basic patient portals and outdated voice response systems direct patients to services are being replaced. And of course, what has evolved in response to the COVID-19 pandemic over the last year. I'd like to start by having each of you maybe give a 30 to 60 second overview of your role at your respective organization. Cheryl, why don't we start with you?
Sure. I'm Cheryl Rodenfels with Nutanix. I'm a former healthcare CIO and Chief Technology Officer as well. And one of the things that I've encountered at the hospitals that I worked at was you had so many generations of equipment and services that it ran everything from something that was brand new and very cloud-like to things that are really still running on XP, and you have everything in between. And when my last hospital merged, I joined Nutanix because I really felt like working in on-premise cloud technology and moving organizations towards cloud technology would help. And what could we do with some of that old stuff that is really taking up space and it's frustrating in our computer rooms? So that's part of what I've been looking at is how do we keep modernizing and getting healthcare organizations better technology to do things they need to do.
Great. Thanks, Cheryl. Kishore, how about you?
Hi, I'm Kishore Ravilla, Chief Technology Officer at OhioHealth, a regional health carrier with 12 hospitals and 200 clinics. We support somewhere between 750 to 1 million patients. This is my first foray into healthcare. I've been with the system for 2 years, and I personally encountered so many things, and I never understood why healthcare is like this. So coming from outside in, I've learned a few things, and we are changing and changed and continue to change some of the things at OhioHealth, bringing in consumer-centric approach and changing the thinking that has been traditionally held in healthcare, because I can tell now with 2 years of experience is healthcare is far behind when it comes to not just embracing technologies, but the concept of consumerism itself.
Yeah, thanks, Kishore. It'll be interesting as we get into the deep dive this conversation, what you've learned from outside of healthcare. Jason, how about yourself?
Thank you. And like Kishore, my name's Jason Miller. I am the CIO of Mednax. We support over 200 hospital systems and provide them NICU and PICU services, as well as provide other specialty medical care for pediatric services. We, similar to Kishore, this is my first foray into healthcare, and coming from the outside and being with Mednax now for about 18 months to 2 years, I've seen very much the same kind of point of view on why can't we be more consumerized and why can't this be easier for people to work in. And, I would say that the COVID crisis has actually driven a forcing of that, because quite frankly, people can't be together anymore. So companies like ours are having to quickly pivot to make sure that we can even do basic jobs on day in and day out.
So that's great. What have been the technology, the learnings around technology, and the learnings around the innovations that you have experienced on the ground in your respective organizations as you're taking a consumer first approach to healthcare, something that obviously propelled forward in the last 12 months? What are those IT data lessons learned that are most important to share? Why don't we start on the health system side, Kishore?
Yeah, thank you, Rajiv. Jason, you rightly said we had, just want to touch on one thing about COVID, right? We had an 18-month change management plan in place to embrace video visits and video health across our system. When COVID hit, we, in 45 days, pretty much 1,000 providers or physicians embraced it quickly. I don't think that level of that accelerated approach towards embracing technology would have happened without COVID. And the first thing we looked at when I joined OhioHealth was what are the preferences customers want to have? Is it SMS level communication? Do they want to have phones, phone communication, things of that nature, right? What surprised me is there is no enterprise-wide view into what the preferences for patients are, right? I mean, if you look at any other industry such as banking or insurance, you will have options to opt out and opt in for things that you would receive from that individual company. But here you are dealing with the lives of patients. That surprised me is that we are relying on EMR to provide those preferences, not at a broader level. How would you want to reach out? If it is just health record side, we are good. But what if patient as a whole, right? How do you view patient outside the care setting? So all those things we are looking at it is, and considering the connected care platform, moving patients' well-being anywhere or everywhere they want to have, just not in the hospital setting. So we are changing the thinking to say that we should give the care or pay attention to where the care is required by the patient and how do we get it to them. And that can't happen without all the required technologies in place, the integration platforms and the communication platform. So we embrace the enterprise integration platform. And from a technology standpoint, those are the few things. But what we were looking at is also changing the thinking more at an enterprise level, right? We started building the capabilities required to make it happen. The enterprise architecture group started thinking more horizontally than actually siloed approach of what does each hospital wants or each clinic wants. So there have been significant change, and COVID certainly helped us move the agenda forward.
Great. Jason, what can you kind of add to that? And great thoughts from Kishore about the learnings from a technology standpoint as organizations continue to focus on becoming more consumer focused and not patient centric.
Yeah, I mean, a lot of what Kishore said is exactly the same things that we're doing at Mednax. I mean, you want the experience to be as simple as making a reservation on OpenTable. Like somebody should be able to open their phone. They should be able to, enter their information, and they should be able, that information should be secure, and it should be, but you should be able to have the capability to create a reservation so that you can go see a doctor. You should be able to transfer your basic health information without having to fill out the same form 53 times as you get passed around from referral to referral. You should be able to have your payment information on file, that if there is an office, if there is an office charge that you need to, that you can do it right there. That stuff should be all straightforward, and it should all be very easy, with the advent of all the technology that we have surrounding us today. But, the model in healthcare has been that it's an office visit culture. You call, the receptionist. The receptionist sets you up with a time, and they fill out the same paper forms. So moving people out of that older thought process and that older mentality, and moving people towards, hey, we can collect this on a phone, we can have this in an app, we can secure this, and we can store it, and with a touch of a button we can send it to you. It has been it's a big change, not only for the patient that helps the patient, but it's also a big change for doctors, because they're now thinking about, how does my office run differently because of the way that this works? And it changes the whole dynamic of how you work.
Cheryl, I know that we've talked on offline about how patient portals sort of feel like this archaic term. Of course, they are archaic solution. Of course, they still exist. Health system websites, they're not so greatly reviewed. When you think about the old school patient engagement tools, and now you think about what we've seen in the last year with registration, digital front doors, signups for vaccines and testing, things like that, how can you kind of compare the old versus new when you think about the legacy systems that had to be replaced and the processes that had to be removed, especially over the last year or so?
Before I go into the technology, let's go into the culture and the thinking. IT still calls the people that use the systems users, and then it's patients. Now we need to call them customers, right? Financial services and other people call them members or customers and so forth. And it really is still users and patients, not customers. So when you're thinking like that, the level of service you as a IT organization is delivering is based on that culture of thinking. But as we shift forward to this, a lot of the technology that was there before, people have, as Jason mentioned, they want to be able to do things on their mobile phones and so forth. If they have better technology than the hospital system that they're interfacing with, they get frustrated, right? And because healthcare is actually a competitive business, a lot of places will take your insurance. There's very few places where you're actually tied to the one hospital. It's gotten very competitive, so you have to keep things just as consumer friendly as possible, because if they don't like what they're doing at your shop, they can go down the road to get that service. And then I think the other thought on that is, if it's so disjointed and it's hard to use, they're not going to. And then what they're going to do is they're going to pick up the phone and they're going to make that phone call and say, I need this. Now they're tying up people's time. There's a bunch of systems that they still have to go through. We spent a lot of time working on clinical workflows of how does the doctor get through the patient, and can they do it in 15 minutes, and notes and all this stuff. We never thought about the patient, the physician referral, the billing person, the patient information, can I please be connected to my patient's room? We stopped really short of that, and we focused where we should have been on the patient stuff. Now we need to do it on the outside looking in. And the tools that we have, if it's not broke, don't fix it, but we need to fix it.
And a lot of it comes down to simply patients have more options, they have more choices, they increasingly have more leverage, and I think your traditional healthcare entities are realizing it. So what does we've heard the term digital front door, it's a little bit of a buzzword that's got accelerated by the pandemic. What are the core elements of a digital front door for a health system? What does that look like to you? How about at OhioHealth, Kishore?
So that's a good question, Rajiv. And when we say digital front door, anything that the patient can do by using a technology, right? Can be using a mobile app to get an appointment, can have a mobile app to communicate with their provider, or they can go to a website and do their find a doc or get appointments or schedules that they can get or get referrals. Anything that doesn't require a manual intervention and the patient can do it or self-service, if you will, and using those front doors, right? That is the point of entry for any patient to get into our health system. So that's what we are pursuing it as. It can be a website, it can be a mobile app, it can be chatbot, it can be any number of things. But what we are embracing is digital is a new norm now. It is not digital is a far-fetched thing or it's a transformational thing. It is the new way of doing business, and healthcare is not immune to that as well. So embracing that thinking and changing the behavior across the system is what we are seeing it as a transformation. So digital front door, we split it into three of them. One is for the patient, the second one is for the associates, and the third one is for the caregivers and physicians as well. So even though we have put the patients first and started on the journey 2-3 years ago with Jim Weiss, my boss, comes from a different industry as well. OhioHealth has decided to bring people from outside to change the thinking and how do we transform ourselves in this journey. So we kind of improved our website presence. You brought up a very good point, Rajiv. Let's not miss sight of that is patient portal is not a EHR, right? If you look at majority of the patient portals today are a representation of your health record, your visit to the physician or specialist. If you're lucky, both of them will be the same. If not, you will go to multiple websites to see what you are going through for each of these visits, right? Imagine what you have an aggregated portal, and just think that as a patient portal that is very much tied to the health system and not your health record alone, right? So we need to create that stickiness, and we are in the process of doing that.
Yeah, I mean, I even remember, back the days of meaningful use, right? When the government said that, patient portals had to be implemented and used at a certain level. It feels like ages ago. Jason, what about at Mednax? What does a digital front door ideally look like to you and your organization?
So I would say that our digital front door has many of the same components that Kishore talked about. The added piece is because we are working a lot of times with expecting mothers, or we're working with at-risk patients, we've had to incorporate as well, how do we monitor health progress as we go forward. So we've also had to incorporate, how do we integrate data from wearables? How do we integrate data from, how do we get call it blood pressure cuffs, or cheap blood pressure cuffs they're digitally enabled? How do we get weight? How do we get weight? Smart weighing machines. How do we get all of those kind of things out to our patients that we can then have a true telehealth experience, where we're able to collect information and we're able to see if things are out of sync, that we can then escalate and get that person to a healthcare facility to make sure that the health of the child, the health of the mother is well taken care of. And we've even taken it a step further to even start doing further monitoring, even when we're not on the phone with that person, to say if something goes out of sync in the middle of the night, we're immediately getting an alert. We're communicating with that person and saying, you have an issue, you want to call a doctor right now, and we need to get you to a facility.
And when you think about an organization's overall digital health infrastructure in its entirety, they're continuing to move from on-premise to cloud. So looking at these services that we're talking about, how are they being integrated into the rest of an organization's digital health infrastructure, which is, again, increasingly moving to cloud? Cheryl, I'd love to hear your thoughts on this.
Well, I think, it's something that we were talking a little bit about before about interoperability. I think, first of all, you have to find the right solution for the right problem, right? And so with a lot of these things, These sorts of systems, these CRM systems, anything that has not only marketing, but running campaigns, let's say for uh, increased mammographies, for diabetes health, for wellness, or anything else. We don't have systems that are built for this. So buying these and not even off the shelf anymore, because that data is so stale by the time you get it installed. So using these as a service managed systems, there's companies that have been doing this sort of thing for a long time, and they're really good at it. And the other thing is they can make changes, they can adapt with you, they can adjust. And the thing is, because you're focused, your marketing people are focused, your clinical people are focused, there are a lot of people involved in how to get this customer experience, how to track vaccinations, how to do online scheduling, how to do all of these things, that if your team isn't worried about keeping the system up and running and do I have enough capacity, and gosh, we just did a campaign and we need room for 30,000 people to respond, if you don't have to worry about that, and whatever the provider is, it's such a relief as a CIO or a CTO to say, wow, we can focus on letting the people who are running these things do their jobs, and we're paying somebody else to make sure that all of that back end happens. That's part of the relief, because we probably weren't that good at some of these things in the first place, but because they're dynamic, we still don't have a lot of staff that is very cloud nimble, nor do they have the skills to be able to adjust that. And we don't have the kind of equipment. We have to buy it out there in advance. We over provision. And what happens if the campaign's a bust, or if something goes out and it doesn't work? Now you're stuck with this big expensive thing. Whereas a lot of these systems are based on use. So if it happens, great. You pay for what you use. So the system remains whole. You've got whatever the goals are you're trying to get after with the particular modules of the solution. And then at the same time, you're being fiscally responsible because you're only paying for what you need. And the other thing is there's so many good metrics that really your time is being spent on the things that matter to the hospital, not maintenance and patching and updating. And my gosh, the system is down again.
Yeah, that's great. It's interesting. You mentioned cloud nimble. I'd love to hear that from the hospital side as well. As you're continuing to move from on-premise to cloud, what are, how you kind of integrating everything into your digital health environment?
Cheryl, you're spot on, right? I mean, those things are going to be there. The things that we are doing differently or trying to do is basically not take a big bang approach. We are the elasticity and the utility-based approach cloud gives is a big benefit for us. Instead of saying that, hey, let's go spend capital dollars, let's take a small approach. We are embarking a journey on the CRM tool adoption. Instead of saying that let everybody, the 2,000, 3,000 people get trained and buy licenses, everything, we want to take a pilot approach and let the trainers train themselves so that it benefits the organization as well, and from a finance responsibility perspective and also change management, right? That benefit didn't exist prior to embracing the cloud approach. In addition to that, I can't emphasize more on what Cheryl touched on, which is the over-engineering or over-provision stuff. I have a living example. We heard that some of the systems were being crashing because of the overwhelming response we were getting for the vaccine portals and whatnot. So when we stepped back and looked at it, our utilization was, at least 1/10 less than what we are provisioned for. So we had 240 users to 400 users that were hitting our system, and we are provisioned for 6,000 users, right? That bandwidth is good if we are consuming it. If not, that is a sunk cost that we have to absorb, right? That the cloud adoption takes that away from us. So in addition to that, what we are doing is thinking more about the API culture. Any product we want to bring in, we want to look if a product can support APIs, because we don't want to be in the business of bringing a product and unable to integrate, right? Because health record is a health record. But Jason pointed out, we just don't want to just take the episode that happens inside the hospital. Can we take the care post discharge, right? Can we send all the BP monitoring or weight monitoring, and can we get the data and use that for the benefit of the patients, right? So those things can only happen if you build that agility inside the platforms that support the APIs. Without that, what happens is we're going to invest in these one-off things, and we get to do a lot of manual efforts to tie these data points that we are, getting, or the data tsunami that is coming at us from all these digital devices.
And from the patient, that's really interesting, Kishore. From the patient perspective, of course, you have these federal interoperability and patient access rules that are really putting the onus on technology solution companies, as well as health systems and payers, to make available, to publish open APIs and make available this data for patients. They can access it and send it to third parties of their choice. How much of a driver do you believe that will have on, patients becoming, much more engaged and kind of opening up that consumer ecosystem?
So I got to quote something I saw on LinkedIn. We're able to get HD images from Mars, but we can't send our health record across the street. Right? If that is a sad state, just imagine, as a patient, you are restricting your mobility of not being able to take your health record with you. So with the adoption of the Cures Act, that we see it as an opening that is going to drive consumers to own their health records, right? And I see that as a welcoming thing, that it's going to evolve much more into that. And with the consumerism and all the things that we have seen during this pandemic, people can work from anywhere. So we are getting requests for individuals that work for OhioHealth wanting to move to different places. The talent or the patients, now it's becoming more and more borderless, right? A patient might say that Cleveland Clinic is much closer now with virtual and everything than it used to be. So if you can get to that level, insurance providing, I'm not talking about all the other nuances that come with that, just saying that the walls for digital are becoming more and more thin, that allows the patient to go to their provider of choice. If we are not going to facilitate this movement of health records, it is just going to be a bad experience for the user, which we don't want to do that, right? Cheryl, I know you don't want to use user, but consumer side of it is we want to make every possible effort to ensure that the consumer is benefiting from the health system. So a lot of the EMRs are now supporting the Cures Act, and they already are because of the federal mandated dates that they have to be compliant with that. We are already supporting it. So a patient can download their or give access to their provider of choice from their health record, and we can transfer that. Is it fully functional, and did everybody embrace it? Yeah, not yet, but the flexibility that gives the patient with this movement of data is going to help them a lot.
To wrap up, let's look at one area where you are really looking forward to kind of evolving towards the next frontier when it comes to patient engagement and becoming more consumer oriented. What's something that you're working on or that you will be prioritizing in the next 12 months or so in this area? Jason, how about you to start?
Yeah, I mean, my view is that we're trying to standardize across all of our practices and across all 200 plus hospitals, that we have the ability that, very much like we talked about earlier, is to get people that they can use something as simple as their iPhone or, pick your smartphone of choice, to interact with their doctor, to download their information, to get their latest test results. We're making progress on that, but that's all stuff that takes time. And even if you have it in areas like Austin, Texas, and San Jose, which you have very early adopters and people that are very, open to new technology, that's not going to be the case as you move across, other parts of the United States. And, getting people to feel comfortable with that, getting people to have both doctors and patients to feel comfortable utilizing that information and utilizing the data they can get from it, and making sure that they feel comfortable that they're giving the best quality, the doctors are giving the best quality care, and the patients are getting every bit the same quality with a whole lot more convenience, is, you know, the next challenge with that, which is really the adoption piece of it, which is where we're kind of moving. And that'll be something that we drive a lot through 2022.
Yeah, that's great. Cheryl, what do you think about the next frontier and something that you're prioritizing, or that, you know, your customers are prioritizing in this area in the next 12 months or so?
The first thing is finishing out whatever the vaccination chaos is. And because the analytics and the reporting requirements have changed the way that they're working, and Kishore mentioned the tsunami of data, which we've talked about before, trying to figure out what data is important to keep and what's not, because it's what we're doing is we're filling up the equipment and the services and the clouds and it doesn't matter what the technology is, we're filling it up with all this data in case we need it. But we really haven't gone back to figure out where is the one copy, where is the system of record? Do I really need to have it in other locations, like where I collect it, or any other kind of reference system? And it's really costing us a lot of money as healthcare providers and you know, people that use technology. So what I'm hoping to look forward to is, let's figure out what we need so we can calm down a little bit and go back to all of this and do a little spring cleaning that says, let's get the data down to a manageable level, because it's the right data to keep for the right amount of time. And healthcare is traditionally bad at that. We keep everything for a long time and wonder why it costs so much to keep going. So figuring out what to do the data, figuring out where we want it, figuring out its relevance, and really getting our arms around it will help us with how much and what do we have to do.
Great stuff. We're up against it. Thanks so much, Kishore, Cheryl, and Jason, for a fantastic conversation. We could have gone for much longer, but we've got another session ahead of us. Back to you, Stephen.
Thank you, Rajiv. Thank you, Kishore. Thank you, Jason. Thank you, Cheryl, for bringing such special guests for your session today. We really appreciate it. Wonderful conversation and a nice compliment to everything else we've covered already today. So as Rajiv said, our final session of the day is coming up at 3 Eastern. Yes, 3 Eastern. And it is going to be all about social determinants of health. It is another powerhouse panel. So I look forward to seeing you there in a little under 30 minutes. And don't forget, we got a big announcement coming up for that session as well. So thank you again to Nutanix for sponsoring, and we'll see you guys in about 30 minutes. Thanks again. Bye-bye.
Thank you.
Bye.